heartburn, chest pain, acid reflux, nausea, all symptoms of GERD, and there is a solution. Here with more details are Dr. Nathan Vattaro and RN Sue Carroll from LifeGuard Wellness Clinic. Good morning. Thank you so much for joining us. First of all, Sue, what is LifeGuard?
LifeGuard is a wellness clinic, and essentially we evaluate you and decide what kind of problems you have and then decide on appropriate testing. And essentially we're trying to make you feel better and try to make your body function better.
Dr. Vattaro, a lot of people have heard about GERD. What exactly is it?
Yeah, so GERD is gastroesophageal reflux disease, which is a fancy word for saying heartburn.
And a lot of pain.
And a lot of pain associated with it for some people.
Okay,
sure.
So what happens if someone has GERD? What's going on?
Yeah, so basically all of our stomachs produce stomach acid, particularly when the stomach senses food inside of it. And it causes your stomach to contract. Well, for some people, that contraction can be violent enough to cause backflow into the esophagus. And when you have acid in your esophagus, it doesn't feel very good.
What are the symptoms if someone thinks they are suffering from GERD?
Yeah, so most people kind of identify with heartburn, chest pain, nausea, gas, bloating, all sorts of digestive complaints like that.
So what are the factors? Why are people predisposed to GERD?
Yeah, some people are. There's certain conditions that predispose to GERD. Being overweight, smoking, pregnancy, asthma, diabetes. These types of conditions are all predisposing factors. But truly, anybody with any kind of gastrointestinal disturbance can suffer from GERD.
So, Sue, is there a particular test that can diagnose this? And does everyone need to get tested for GERD?
Yes. First of all, not everyone needs to get tested. Often we can diagnose people and give them the appropriate treatment just based on their symptoms and the history that they have. However, for some people that have a lot of health conditions or a lot of gastrointestinal symptoms, it may be a good idea for them to have this CDSA test, which essentially is a stool test. And what that does is evaluate your gastrointestinal function, whether you're digesting your food appropriately, whether you're absorbing the nutrients from your food, whether you have enough probiotics, whether you have bacteria in your system that's not the helpful bacteria, different things like that. So sometimes we do recommend that test, but it's not necessary for most of the people.
How long does the test take?
The test is a 3-day stool collection test.
So, Dr. Vattaro, what medications are usually prescribed, and are there other alternatives for people out there?
Yes, on both accounts.
Hey.
Yeah, a lot of the acid-blocking medications, as you see here, are what's commonly prescribed and now available over the counter, so a lot of people take that. They are only meant for short term, though.
Okay.
And so on the alternative side, we look at promoting healthier digestion. We want to make sure that your body is digesting and assimilating nutrients as best it can. So we utilize digestive enzymes quite a bit, which actually break down the food. And then we also use probiotics, which are healthy bacteria that line the GI tract, again, for optimal assimilation of nutrients.
And to a lot of people out there might be thinking to themselves, that sounds like something I suffer from. You guys have a special promotion for your Life A to Z viewers.
Yes, we hope that you'll come in for a consult, and we will offer to you a free bottle of digestive enzymes and also a free bottle of probiotics when you come in.
So this is something that people, they don't have to live with. They can get the help that they need.
Absolutely not. And it would be more helpful for them if they get the help they need.
All right, well, thank you so much. A lot of great information. And of course, for more information about LifeGuard Wellness Clinic, just visit them online at lifeguardclinic.com or call the number on your screen.